Now coming to the proton pump inhibitor. Proton pump inhibitor, that is, first drug is the omeprazole. Omeprazole is the first drug of proton pump inhibitors. Now it is a powerful inhibitor of the gastric acid secretion because it inhibits the secretion of hydrogen ions. So whenever there is no hydrogen ions, there is no formation of HCl. So that's why the proton pump means that pump means that it is defined, it can be defined, the pump created between the exchange of potassium and hydrogen ion by the action of the enzyme adenosine triphosphatase, which gives the energy for the exchange of these two cations. So that's why if we inhibit the hydrogen ions, that is known as proton pump inhibitors, powerful inhibitor of the gastric acid secretion in resting as well as in the stimulated stimulated by food, in gastric acid secretion in resting as well as in stimulated by food, because whenever we take the diet, we take the food, this food is then stimulate all the components of the GIT to secrete their secretion. So that's why this drug inhibit the secretion in the resting state as well as those which stimulated by the food. Effects on pepsin, that is intrinsic factor. It is a pepsin intrinsic factor. It inhibit the pepsin also. Now omeprazole is inactive at neutral pH. It is inactive at neutral pH. Now you know that the proton pump inhibitors shows their action in that media which is highly acidic, in neutral pH, in alkaline pH. These drugs are not active and they won't show any pharmacological effect. So they are inactive at neutral pH, but at pH less than 5 rearranges to two-changed cationic form, two-change charged cationic form, that is in less than 5 pH. They rearranges to two charged cationic form that reacts covalently with the SH group of the hydrogen potassium ATPase. SH group means the thio group. This is the thio group, and you know that the ATPase, adenosine triphosphatase, is nothing but the enzyme. So enzymes are composed of amino acid. Those enzymes which are having the amino acid cysteine or cysteine, they are and other amino acid which are having SH group in their structure. So this SH group help in the formation of covalent bonding in this enzyme and inactivate it irreversibly. Now, acid secretion will only takes place when there is synthesis of new hydrogen potassium ATPase synthesized. Now you know that in these lines we have discussed that they inactivate the enzyme hydrogen potassium ATPase. Whenever there is inactivation, means that there is no further activity of the enzyme. Enzyme becomes purely inactive and it is irreversible. Now again, you must be knowing better that what is reversible inhibitors, what is irreversible inhibitor. Reversible inhibitors are those that when we increases the amount of the component or the chemical compound, then there is competition, and if that amount is more than that which inhibit the enzyme, they can compete, they combine with the receptor and then they can synthesize or they can activate that particular compound. So irreversible means that there is covalent bonding occurs between that. This covalently binding with SH group causes the irreversible inhibition. So there is no activation of this enzyme again. So if there is requirement of the enzyme by the body has to synthesize the new enzyme. Body has to synthesize the new enzyme. So that's why there is synthesis of this new enzyme takes place. They also inhibit the gastric mucosal carbonic anhydrase. Now, gastric mucosal carbonic anhydrase. Now, what is the role of carbonic anhydrase? Carbonic anhydrase means that they split the carbonic acid into hydrogen ions and bicarbonate ions. So, when there is inhibition of the enzyme carbonic anhydrase, there is no effect on the carbonic acid and there is no formation of hydrogen ion. So, that's why again it is the action of as a proton pump inhibitor, Clear? Now coming to the bioavailability of all proton pump inhibitors. The bioavailability of all proton pump inhibitors reduced by food. They should be taken in empty stomach. So these inhibitors should be taken in empty stomach because food interferes with their absorption. So, or followed 1 hour after by meal. If a patient going to take this proton pump inhibitor, there must be a gap between the food and the time to take the drug, that is just at least 1 hour later by meal, to activate the hydrogen potassium ATPase to become more susceptible to the proton pump inhibitor. Clear? Now, they are metabolized by CYP3A4. What is CYP3A4? CYP3A4 is a kind of the cytochrome B450. So it is responsible for the metabolization of these drugs, that is proton pump inhibitors. The T half is less than 1 hour. Metabolize the drug, and these metabolites excreted in the urine again through the kidney. Action lasts for 3 days. Prolonged use may cause hypergastremia. Hypergastremia means that there is hypergastremia and increase the secretion of the gastric secretion. Prolonged use gastric hypergastremia. That is, there is increased kind of the bleeding. And the achlorhydria. What is achlorhydria? Achlorhydria means the decreased secretion of SCN. Increased secretion of SCN is known as achlorhydria. Now, therapeutic uses. Again, as you know that it is the subject of pharmacology and therapeutics. Up to now we have discussed its pharmacology. Now the therapeutic uses means how we can use these drugs for the treatment of the peptic ulcer. It is known as their therapeutic uses. First, the peptic ulcer. 20 milligram once a day is more effective than H2 receptor blocker. So once a day, 20 milligram is more effective than the H2 receptor blockers. Healing of complete ulcer requires 4 to 8 weeks. If the patient is suffering from the ulcer, then the healing of the ulcer requires 4 to 8 weeks. Complete healing, 4 to 8 weeks. Proton pump inhibitors are the drug of choice in NSAID. NSAID means non-steroidal anti-inflammatory drugs. So proton pump inhibitors are the drug of choice in case of NSAID induced. If NSAIDs are entered or induced or given to the patient, they may cause the gastric and duodenal ulcer. So the proton pump inhibitor counteract the effect of this NSAIDs. So that's why they are the drug of choice in NSAID induced gastric and duodenal ulcer. Now, bleeding peptic ulcer. Bleeding peptic ulcer means when the ulcer becomes in the condition where the cells of the stomach starts to bleed, that is known as bleeding peptic ulcer. So bleeding peptic ulcer, these proton pump inhibitors can be used in the treatment of bleeding peptic ulcer. Acid enhances the clot dissolution. Promoting ulcer bleeding. They help to reduce the blood loss and rebleed. That is again, and an effect on the therapeutic use of the proton pump inhibitor. Proton pump inhibitor. Now, stress ulcer. Usually the stress ulcer is known as physiological ulcer or physiological stress. Whenever the patient or the person is under the stress, you know that you may feel it that when the person becomes stressed, they is having the heartburn feelings like the heartburn. It is due to the excessive secretion of the SCL in stressful condition. So in this that is known as stress ulcer. So intravenous pantoprazole is effective, used prophylactically. Pantoprazole is the drug which is used intravenously to effect or to treat this physiological stress ulcer, and it is used prophylactically. Prophylactically means एहतियाती तौर पे अगर हम इसको इस्तेमाल करेंगे prophylactically in the stress condition, so automatically there is decrease in the levels of SCL. Now, gastroesophageal reflux disease. I told you about this GERD, very important term, that is gastroesophageal reflux disease. Gastroesophageal reflux disease. Now, this disease occurs when stomach acid frequently flows back into the tube containing, that is, into the tube containing your mouth and stomach. Because sometimes you feel that the food we take, after some time, there is a feeling that the food comes back into the mouth. Food comes back into the mouth. It is the feeling that food which entered into the stomach now starts coming back to the mouth. This is known as gastroesophageal reflux disease. This disease occurs when stomach acid frequently flows back into the tube containing your mouth and stomach, connecting your mouth and stomach. That tube which connects the mouth to the stomach, that tube having the feeling, the person feels that the food comes in that tube, from that tube it comes in the mouth. So that is known as also gastroesophageal reflux disease. That is the flow back into the tube connecting your mouth and the stomach, that is esophagus. This acid reflux can irritate the lining of the esophagus. So this reflux of the food content or the food component into that tube may causes or may irritate the lining of the esophagus. So it may cause the chronic esophagitis. It may cause the chronic esophagitis, that is the infection of the destruction of the esophagus in the stomach wall. So chronic esophagitis, that is stage 2 or 3 GERD. Stage 2 or 3 GERD. So in this case, the dose is 20 to 60 milligram per day in 1 to 2 doses. Means that you have to take 20 to 60, not less than 20, not more than 60 milligrams per day. Now you have to take this drug in one day, but in 2 doses. But it should be divided in 2 doses, 1 to 2 doses, right? Now, fifth one is Zollinger-Ellison syndrome. Omeprazole is a proton pump inhibitor. It is more effective than H2 receptor blocker in case of Zollinger-Ellison syndrome. Means when there is excessive secretion of the high hydrochloric acid or HCl takes place, then omeprazole is proton pump inhibitor, more effective than the H2 receptor blocker. 6 is aspiration pneumonia. Aspiration pneumonia. It is a lung infection. It is a lung infection that develops during inhalation. Inhalation means that when you inhale, that the aspiration pneumonia can be developed. It may be due to the food, liquids, or vomit enters into the lungs. Either the food or the liquid or the vomit. Sometimes when the patient vomits, and if the patient feels that vomit enters into the tract of the respiration, that is respiratory tract, and and enters into the lungs. So the food, liquid or vomit when enters into the lungs, this is known as aspiration pneumonia. Also aspires from stomach that back up in esophagus. So from esophagus they can enter into the stomach, into the lungs. Now the proton pump inhibitors are more useful as H2 receptor blockers for prophylactically for prolonged anesthesia, because aspiration pneumonia usually occurs during the anesthesia. So for prolonged anesthesia means the anesthesia when required for the major surgery, that is in case of general anesthesia, the proton pump inhibitors can be used to avoid the aspiration pneumonia. Now the adverse effect: nausea, loose stool, headache, abdominal pain, muscle and joint pain, dizziness reported in 3 to 5% of the patient. Now interaction, that is, it inhibits the oxidation of diazepam, then phenytoin, warfarin, and causes increase in their level. So I think that you all will be following this lecture. Now the last slide for today's lecture. It is the drug which is known as esomeprazole. Esomeprazole, more potent in GERD. We have discussed in our previous slide about the GERD. So esomeprazole is more potent in GERD than omeprazole. T-HAP is more than that drug. Dose is 20 to 40 milligrams only, right? Next is the lansoprazole. Lansoprazole also more potent than the omeprazole. Inhibition of hydrogen potassium ATPase is partially reversible. Not completely reversible, but partially reversible. So higher bioavailability, longer T-HAP, so longer duration of action. Then pantoprazole. Pantoprazole not inhibits the hydrogen potassium ATPase. More acid stable, lower affinity for the P450. Lower affinity for the P450 means the less metabolized by this enzyme, that is known as P450. Cytochrome P450 present in the liver, it is less metabolized by this enzyme. Now anticholinergics, anticholinergics is also used as a proton pump inhibitor, that is atropine, propylethylene, oxyphenonium, having more side effects, so that's why they are not recommended as a proton pump inhibitor. They are not recommended as a proton pump inhibitor due to their severe side effects, right? Now next is the prostaglandin analogs, that is prostaglandin E2, prostaglandin I2, produced in the gastric mucosa, inhibits the acid secretion, promoting, because now there is no you used to discuss in detail. We have discussed in detail about these analogs, that is prostaglandins, during the autoquites. So prostaglandin E2 and I2 produced in gastric mucosa inhibits the acid secretion, promoting the mucus and bicarbonate secretion, showing cytoprotective action. Protective action means they are responsible to protect the cells of the stomach. So next is the misoprostol, which is the methyl derivative of the prostaglandin E ester. Methyl derivative of the prostaglandin E ester causes decreased acid secretion, may cause diarrhea, abdominal cramps, and uterine bleeding. Diarrhea, abdominal cramps, and uterine bleeding. So that's all for today. I hope that you will understand, you have understand all these points. And if there is any problem, now my dear students, I have delivered the lecture on this drugs acting on the GIT or the gastrointestinal drugs. If you feel any problem, any difficulty, you are having my cell number. You are present in the group of the second prof. So if you feel any problem, any difficulty, you can ask to me. I will explain it you to on this phone or in the groups, right? So be careful, please read it, please learn it, and any difficulty, if there is any problem, any difficulty, you can ask. And it is the responsibility to the CR and GR of your class that you have to convey the message to all the students of your class that they have to listen this lecture carefully with full concentration, because if you will not read it, you will not learn it with full concentration, then you will be unable to follow the lecture, you will be unable to write down anything. So this lecture is very important. You know that in the past papers there is repeatedly the proton pump inhibitors are there, H2 receptors antagonists are there. So you have to learn it very carefully and very patiently, right? Thank you so much, so nice of you, because you are not sitting here. I just imagine that you are here, so that's why I'm saying like this. Okay, Khuda Hafiz.